Hello, welcome to another post from Dr. Blake's Healing Soul. Today our athletic trainer, Aphrodite, will explain how to strengthen the posterior tibial tendon, often injured in athletic activities.
Okay, so typically when we strengthen, the first thing we want to do is work on active range of motion. That's the easiest. So when you do active range at home, what you want to do is make sure that you're isolating the posterior tibialis. You're going to have your foot plantar flex slightly, and you want to come in, invert your foot as far as you can. If you have pain with a long range, you want to keep it short. So remember to always keep it pain-free. Try not to compensate with your lower legs. You want to try to keep it really nice and still. So go ahead and try active range. Go in as far as you can without pain, and then back out. Good. So we want to make sure we start with no resistance initially.
And how many sets and reps would you have the patient?
Typically, I'll have them do 1 set of 10. If they fatigue after a set of 5, I'll break it up to 2 sets of 5. And then I go anywhere from 1 to 3 sets total.
Great.
So that's the first step. Then I'll progress them to isometric strengthening. So you can either, there are various ways you can do it, but basically isometric means that you want to hold it in a certain place. So if I were to have the resistance here and you go into inversion again, go ahead, you just hold it in that specific place. And then I usually have them hold for about 10 seconds if they can tolerate it, and then relax. So when you do it at home, you can do it against a wall, kind of like this, and then just go against it, or do it against a pillow if it's uncomfortable doing it straight up like that. So I would go 10 sets, or 10 repetitions, 10-second hold, and start with 1 set and then progress to 3 as tolerated. And next we're going to go to resistive strengthening. So same thing, but this time you're using a TheraBand, which you can tie to something like a table leg, and make sure there's enough resistance so you feel you're actually getting a benefit out of it. So go ahead and go into inversion again. Good. And then slowly back. Make sure you're really controlling it on the way back. Good. And then go again.
And it's important for the patient to focus that the anterior tibial is not tightening.
Right, so make sure the patient isn't going up and in, because then that anterior tibialis will kick in. So make sure they're always in that plantar flex position going in. Very good. And again, no pain. So if the patient feels pain with this, they're probably not ready to progress to resistance. So stick with isometric for now, or active if that's what causes no pain.
The TheraBands, or the resistant bands, have many colors and levels. Do you recommend starting at a certain level?
Yes, start at level 1. This is the easiest one that we have. And then as you get stronger, you can progress to level 2, 3. We go all the way up to 6 here. They have various levels of resistance.
Great.
And then once that feels really easy, you can progress to more functional exercises. So come on up. You can try single leg balance. That's the easiest as far as functional single leg balance. So this won't isolate the posterior tibialis, but it will definitely kick in during this exercise.
And how long do they stand for this?
For this one, the goal is to try to hold it a minute, but typically when they're weak, they won't be able to go more than 10, 15 seconds, and then progress to 30 seconds, and so on. And then a way to make it a little more challenging is they can actually stand on something that's unstable, like a towel or a wedge or something like that.
Does that make it harder?
Yes.
And I think it's good to stand like in the middle of a doorway or next to something that you can catch yourself when you're doing these functional exercises.
And you can even scoot your foot more towards the edge of the towel, and then try that again, and the posterior tibialis will work a little harder to make sure that you stabilize on
patient here is sort of inverting the foot and then trying to balance off that position, which is much harder.
And once you master that, you can try it with your eyes closed to make it even more challenging.
You can tell this patient is a Pilates yoga expert, balancing really well. So how does the patient, Aphrodite, know to progress from active range of motion to isometric to progressive resistance to functional?
The main indicator really is pain and the ability to do it, really. So once active range of motion feels really, really easy, then they're ready to progress to isometric. And then once they do isometric, pain-free, and they're able to do it, again, about 3 sets of 10 is the norm. If they feel that becomes very easy, then they can progress to resistive TheraBand. And then once that becomes easy and pain-free, they can progress to more functional exercises such as single leg balance.
Great, and I'd just like to emphasize that you really want to start strengthening the minute you're injured. So as soon as you have an injury, you want to start at least doing some active range of motion, as long as it's pain-free, to keep the tone in the tendon and muscle. All right, well, thank you very much, Aphrodite.
You're welcome.